Hello, I'm Jessica Drummond from the Integrative Women's Health Institute. And this morning we'll be talking about how important it is for women in the preconception phase. So they're not trying to get pregnant yet actively, but they're considering it. So the preconception phase is essentially from when a woman starts to consider getting pregnant up until about 3 months prior to pregnancy. So she gives herself some time to prepare her body before she initiates trying to get pregnant. Now, we don't always catch our clients in this preconception phase. Sometimes they're, moving into pregnancy or already, or they're at least trying to conceive. So what we're going to talk about today is how really focusing on the health of the mother and also the father. We're not going to get deep into that today, but we do talk about that in our upcoming program on optimal fertility. We'll be focusing in that program on preconception, detoxification, and preparation for both mothers and fathers, both men and women. So today, we're going to talk about some simple things that we can do as clinicians to really support a woman really focusing on her optimal health in order to have a healthier and easier pregnancy, in order to make it easier to get pregnant at all, and ultimately to have healthier babies and a happier experience. So let's jump right in. So the best part about working with this population for me as a clinician is that it's really, for the most part, a time of joy and a time of motivation. A lot of times when our clients come to see us in other populations, they're injured or not feeling well. So they're motivated out of necessity, out of reducing pain or illness or fatigue. This population is more motivated by positive things. They're excited about growing their family. They're excited about pregnancy. They're excited about what they can do to have the healthiest baby on the block and the happiest baby on the block. And so for the most part, working with this population is a lot of fun. Now, we do have our clients who struggle with infertility and struggle with relationship issues and struggle with health issues prior to pregnancy. And that also is very rewarding because there's so much we can do that often our clients and patients are not aware of. And just having that support can really ameliorate the stress that they're undergoing if they are having health issues or fertility issues during this normally quite happy and motivating time. So as I said, for some, unfortunately, it is a time of struggle. So the World Health Organization estimates that approximately 10 to 15% of couples worldwide do struggle with infertility. Now, the wonderful thing about this for us as integrative health professionals is that there's a lot more that our clients who are struggling with infertility can do than often they're made aware of. A lot of times their physicians don't really know about these options or they just aren't aware. So 2 things that contribute greatly to the success of being able to get pregnant, either naturally or using assistive reproductive technologies like in vitro fertilization, are physiologic inflammation, so inflammation in the body that's often systemic, and psychological stress. And as holistic and integrative practitioners, we can do a lot to decrease inflammation and to decrease our clients' relationship with physiologic stress and psychologic stress. We can't always remove all of their stress, but we can help them understand it better, manage it better, have tools for reducing it, and tools for just recognizing that stress is a normal part of life and it's not always something to be feared. In fact, depending on the kind of stress, often working with it can help to minimize it. So when we when we do both these things, we reduce inflammation and we adjust our client's relationship with stress, psychological stress, we actually improve their physiologic ability to get pregnant either naturally or with the help of assistive reproductive technologies. So we have a lot to offer this population, and they're really looking for your services. So one of the most simple concepts, but really important concepts in this population is that when our clients are stressed, whether that's a physiologic inflammation. They're walking around with food sensitivities or leaky gut or some other chronic low-grade infection like candida, for example, a yeast infection, or bacterial vaginosis, any kind of digestive dysbiosis, so the bacteria in their digestive system are not in balance. This causes a chronic form of stress, a physiologic stress that requires the body to take care of it, buffer it on a regular basis. And when that happens over a period of months or years or even weeks, the same raw materials, cholesterol, which is then converted into pregnenolone, are used to make both sex hormones and stress hormones. But the body prioritizes stress hormones because stress hormones are stress buffering, and they are really more of your sort of life or death hormones. The body is always going to prioritize taking care of physiologic and psychologic stress before it prioritizes sex hormones, because that's more icing on the cake, not 100% necessary for survival, but it is nice and necessary in this population who are trying to get pregnant. So we want to reduce any physiologic or psychologic stressors so that the cholesterol and pregnenolone resources can be more directed towards making healthy, fertile levels of sex hormones like estrogen, testosterone, and progesterone. So what is the definition of stressful? So on a physiologic level, as I said, inflammation that can be initiated from common food sensitivities like sensitivities to gluten or dairy, gut dysbiosis, which is the imbalance between pathogenic and commensal bacteria in the large intestine, small intestinal bacterial overgrowth, otherwise known as SIBO, where you have larger colonies of bacteria in the small intestine. Even if they are, quote unquote, good bacteria, they don't belong in the small intestine. They belong in the large intestine. So when they hang out in the small intestine, that causes a chronic inflammatory state. Of course, psychologic stress often can lead to things like leaky gut. Certainly changes cortisol levels, which, as we just saw, can wreak havoc on a woman's healthy sex hormones, which is really a big problem in women who are trying to get pregnant. They also may have challenges with just keeping their cycles regular, not too heavy, not too light, not losing their cycles. So making sure their cycles are ovulatory. All of these things depend on healthy levels of sex hormones, which can be robbed by both physiologic and psychologic stress. Chronic illnesses, surgeries, and other things can cause both physiologic and psychologic stress. So, what are some things we can do as integrative and functional practitioners to focus on reducing that physical inflammation, that physiologic stress? So the bottom line is, if you don't remember anything else from today, think about when we have a healthy belly, and by that I mean stomach acid, small intestinal function, large intestinal function, and so forth. The digestive system functioning optimally equals a happy belly. And a happy belly makes it a heck of a lot easier for a woman to be generally healthy, but also healthy enough to be fertile, and so to get pregnant easily, to sustain a pregnancy, and to have a fetus and infant that are healthier. So we have a lot of work we can do in terms of gut healing, and there is some really good specific research in this population. So specific strains of probiotics reduce the risk of genital infection in pregnant women by up to 81%. So again, there's so much we can do with this population. Probiotic foods, so simple things like really high quality forms of yogurt and sauerkraut, may reduce the risk of preterm labor in some women. So we have tools available for us to help support a woman's optimal health so that it's so much easier for her to get pregnant and remain pregnant and have a healthy and joyful pregnancy. So stress, psychological stress does not have to feel like, I'm pulling my hair out. It does not have to feel like that. Despite the fact that psychological stress can cause some physiologic challenges in the body, when women have tools to deal with that stress and can have perspective, so a shift in their relationship with stress, that can really change their response. So the actual stressor may not have changed. Maybe they're still very busy at work. Maybe they still are moving or are going to move. Maybe they still are having challenges with their intimate relationship or their family relationships. These stressors don't have to change for the physiologic and psychologic response of your client or patient to change for the better. So we can learn coaching skills to help our clients really change their perspective on how they're viewing stress. And we can learn skills to reduce the overactivity of the sympathetic nervous system to keep them feeling calmer as they're just going about their day, even if the underlying stressor has not changed. Now, all of these measures that reduce chronic inflammation, whether they're on the physiologic side of the scale or the psychologic side of the scale, help with actually increasing fertility rates. And we have tools for this. Cognitive behavioral therapy is very helpful for psychological stress. Progressive muscle relaxation has been tested in populations of women who are struggling with fertility, and other strategies. All of these have been shown in research, published data, to reduce inflammation and improve the success of in vitro fertilization. Similarly, women born to obese women who have increased inflammation. So there are consequences to not dealing with this inflammation. So let's say a woman gets pregnant despite having some chronic inflammation, which, is more and more common as women are generally less healthy in younger years. We have, 8-year-olds and 12-year-olds with type 2 diabetes. We have an increasingly obese population at younger and younger ages. So if these women are getting pregnant despite, underlying levels of chronic inflammation, there are consequences for the health of their babies. These babies tend to have more neurodevelopmental impairments and other kinds of physical and emotional impairments that can be long lasting. And it does increase the intrauterine environment plays a role in that baby's long-term health. So if we can start working with younger women in their 20s and early 30s to really get themselves glowingly healthy, reduce that chronic inflammation, it's excellent for them, and it's excellent for their babies, not just their ability to get pregnant, their ability to stay pregnant, their ability to have healthy babies, but also for those babies to grow up and be healthy adults in the long term. So in our program on optimal fertility, where we focus on preconception detoxification strategies and preparation strategies, we discuss deep detail about digestive physiology to help your client reduce inflammation related to food sensitivities, gut dysbiosis, lack of antioxidants, and other factors that are specifically important in this population, where we have strong evidence, published data in this population of patients who are struggling with fertility, who are wanting to get pregnant and have really healthy pregnancies and improve their odds for getting pregnant, whether they do it the old-fashioned way or using assistive reproductive technologies. So stay tuned. In the next video in this series, in our second video, we will discuss when and how to offer safe and effective detox programs to the women in your community who are trying to conceive or thinking about that preconception phase where they're thinking about trying to get pregnant, who, even if they already are pregnant, so if you've missed that golden window, it's not too late. There are a lot of things you can still do once a woman is pregnant. And even if they are postpartum and breastfeeding, there is no need to wait. There's no need to worry that you've missed the window. There are things that can be done safely and effectively that are evidence-based in terms of supporting the mother's health through the entire perinatal year, really. We have the preconception phase, the pregnancy, the trying to conceive phase, the pregnancy phase, and the postpartum phase. And there's a lot you can offer in all of those phases. So we'll talk more about that in the next video. And I will see you there. Have a great day. Bye-bye.